Thank you.
Are you on the queue? Maybe on another matter?
Thank you, Chair. I don't know why Senator Sifuna is uncomfortable about nurses, yet he was proud of them the other day. Mr. Speaker, I raised to support the motion yesterday, consideration on the report by the alleged negligence of Mercy that led to the death of Mrs. Anita Chepkorir at Moi Teaching and Referral Hospital. Mr. Speaker, as I rise to support this motion, I want to pass my deepest condolences to the family and friends on the death of Anita Chepkorir, which unfortunately happened in 2021 due to medical negligence at Moi Teaching and Referral Hospital, Mr. Speaker, sir. Mr. Speaker, sir, remember this young girl was only 6 years old, full of life, but because of medical negligence, Mr. Speaker, we lost her. And it is because of medical negligence where the doctors at that hospital failed to locate the foreign body that had been swallowed by her, Mr. Speaker. So this is sad, and medical negligence is becoming a predominant problem, especially in our hospital institutions, Mr. Speaker. And the procedure that was performed, Speaker, did not, and in the process of doing surgical procedures, Mr. Speaker, sir, the doctors led by Dr. Odingo and the team that did the operation, Mr. Speaker, did not remove the foreign body, but they end up and accidentally removing two tooth, which they end up removing, and therefore that foreign body remained within the lungs even after bronchoscopy and thoracotomy, Mr. Speaker. They were not able to remove, and therefore with time it led to very serious pneumonia that led to the death, unfortunately, of Anita Chepkorir, Mr. Speaker. So this was clear violation. You know, under Article 43, Mr. Speaker, of the Constitution, every Kenyan has a right to affordable, quality health care. And as much as we celebrate medical practitioners in this country, they do a lot, Mr. Speaker. They do a lot in Meru County Hospitals. They do a lot in Migori, in Nandi, in Nyandarua. We know what the challenge is, Mr. Speaker. I remember, and I know, in as much as we are blaming that they were medical negligence, Mr. Speaker, I know the challenges our medical practitioners go through. Some of them, like UHC, Universal Health Coverage, Mr. Speaker, some of them are yet to be confirmed under permanent and pensionable, which is still very unfortunate. Yet during the COVID-19, Mr. Speaker, they were the only people who rose and fought COVID pandemic, while the guns, the bullets, the heavy artillery stayed in barracks. But it's only the UHC staff. Mr. Speaker, I am happy that today I have seen the comments from the chairperson of Finance and Budget in the Budget in the National Assembly, the member of Aleko Usonga, that they will budget for the absorption of permanent and pensionable of UHC staff and also payment of gratuity, and ensure proper and clear transfer of services of UHC staff to county governments across the nation. So that is the issue I was saying yesterday, Mr. Speaker, that let us be fair to our medical staff. So, Speaker, I once visited Maraba Sub-County Hospital. Do you realize they don't have PEEPs, protective equipments, personnel, Mr. Speaker? I visited one of the rooms which they do cesarean section at the Maraba Sub-County Hospital in Maraba Township, and it was very sad that they don't have even gloves, Mr. Speaker. They don't have protective gear, even as they perform surgical procedure of CS to our mothers across that area of Maraba. Even when you go to Nandales Hospital, come to Kapsabet, I visited, even the services, even Mosorio Sub-County, you go there, you visit the kitchen. Mr. Speaker, when I visited the kitchen of Mosorio Sub-County Hospital, it was very embarrassing. It is very dirty. You could see cockroaches walking and doing a catwalk in Mosorio Sub-County Hospital, where our food for the sick should be met, Mr. Speaker, even the clubs. So I know our medical practitioners will always have a challenge, especially with the issue of health in this country. Mr. Speaker, on this case of the medical negligence of Anita Chepkorir in Moi Teaching and Referral, Mr. Speaker, you have to appreciate that apart from Kenyatta National Hospital, there are other 2 referral hospitals outside the city. Is only Moi Teaching and Referral Hospital. It is very sad, Mr. Speaker, when you listen to this story, that even the Moi Teaching and Referral Hospital management and even the people who did operation led by Dr. Odingo and company did not have even the humane, that empathy towards the parents of the 6-year-old daughter, Ms. Anita Chepkorir. So, Speaker, I know, you know, in as much as sometimes some deaths are not preventable. On this case, it was preventable. And therefore, Mr. Speaker, I'm happy that the Health Committee, led by Senator Mandago, who happens to hail from the same county where this death happened, and I think at that time he was the governor of Wazingishu, because it was in 2021. So, Speaker, it is very unfortunate that there was a disjointed communication between the patient and post-care, and even during operation, Mr. Speaker. It was noted that Moi Teaching and Referral Hospital, which is one of the biggest referral hospitals outside Nairobi, have a poor record keeping. Say that the people who admitted and released the girl, Mr. Speaker, did not even, there was no proper trailing of the records since when the patient was admitted, during the surgical procedure, during the recovery period, and even during post-care and after-care after the patient was released from the hospital. It is very embarrassing. With the era of technology, I would have expected Senator Mandago-led Health Committee to indicate that and even call out Moi Teaching and Referral Hospital for having a very poor record keeping with the current technology. In fact, these young people who are insulting and demeaning and criticizing leaders on social media, Mr. Speaker, if we can rechannel their energy, we can give them a job in Moi Teaching and Referral Hospital to prepare health records so that we are not embarrassed by these deaths that occurred out of medical negligence. So I would have expected in this report led by Senator Mandago to indicate that Moi Teaching and Referral must be called out for poor record keeping. Because with the click of the button, with the era of technology, it should have been easy to do referrals and ensure that this patient was well taken care of. This is a death that is preventable, Mr. Speaker. It should not have happened. So in these recommendations and this lack of breakdown of communication, it should have been looked, Mr. Speaker. Mr. Speaker, this issue of recovery, in fact, when you read the report, Dr. Odingo and company, and even aftercare services after the surgery when the young girl was released, no one did refer to the team that did the surgery. Even they didn't do even review of even doing a CT scan after the surgery. Yet the foreign substance was still within the body that later caused the pneumonia, Mr. Speaker, and later killed the young girl who was only 6 years. As we empathize and sympathize with the family, it should not happen in a modern day Kenya. You know, we can pray. The day was National Prayer Breakfast. We can pray, but some things we must do it before praying, Mr. Speaker. We must work hard to ensure that, and therefore, I hope as the committee looks at this report of the Health Committee, they should amend and ensure Moi Teaching and Referral comes up with the organized, technology, savvy, proper keeping of records in the hospital, Mr. Speaker. Mr. Speaker, quickly, so that I can cede ground for my colleagues to also, it is also sad because under Article 40, human rights is a basic right, that the police by the mother, by the name Mercy Chepchirchir, was ignored. And Moi Teaching and Referral Hospital has a public relations department. The complaints and the pleas by the victim or the complainant were ignored until she had to seek refuge at the Senate, Mr. Speaker. We must be told, I expected in this report by the health to recommend administrative action against Public Relations Office of Moi Teaching and Referral Hospital in Eldoret to tell us why did they ignore. So, Speaker, imagine you are a parent. All of us are parents here. I don't know about Medu, but all of us who are parents, and also Senator Eddy, I'm not aware whether they are parents or not, unless they go on record to tell us they are. Mr. Speaker, all of us are parents. We know the pain of losing a child. Imagine that when she wanted to complain before the hospital, Mr. Speaker, there was no even empathy to listen to. This is somebody's child we have lost, Mr. Speaker. Therefore, I expected the health committee to recommend that administrative action must be taken against public relations officers and any person who deals with relations of public, Mr. Speaker, at Moi Teaching and Referral Hospital. Mr. Speaker, that is the only list we could do. I can imagine if this is Moi Teaching and Referral Hospital, how many hospitals have lost their lives? I remember a case in Isero, Mr. Speaker. There is a girl who delivered properly in Kabiet and she was later brought. To Mosorio, where she bled to death. The county government of Nandi did little or nothing to even give counseling or even that listening here for the complaint against negligence where she had gone to deliver and there was a botched cesarean section procedure, Mr. Speaker. So I want to call upon that we must be empathic, even in this report. And I hope there is members of health in this committee. So, Speaker, even in this report, they have not recommended for socio-psychological support to the parent. Because after losing the child, they can even go into they can go even to they can even develop some stress and even, Mr. Speaker, they can even have suicidal thoughts. This is somebody who has lost a child, Mr. Speaker. So I hope in the future, and this is my advice to the committees, Mr. Speaker, you are aware in the Constitution, you are one of the long-serving members of Parliament in this House. The Senate and Parliament enjoys the High Court status. So whenever we make recommendations, we must make recommendations like the High Court. Mr. Speaker, let's quickly go to the recommendations that this committee did develop. I'm happy, but I'm sad. What the committee recommended is sweet and sour, like the Chinese dish, trying to run away from this responsibility and then apportioning blame. So, Speaker, the reading of Section 20 of the Medical Practitioners Dentist Act, Cap 253, Section 20, as revised in 2012 and 2019, is very clear on disciplinary procedures. One of the grounds, Mr. Speaker, is you can caution. You can issue caution or you can reprimand. You can also, Mr. Speaker, order remedial cases for doctors or medical practitioners. I expected, after the procedure was done, Mr. Speaker, do you know 2 procedures was done? Trichotomy and another one related to brachiotomy, Mr. Speaker. 2 was done, but they never removed the foreign body. It means the doctors led by Dr. Odingo and company, that the surgical team, Mr. Speaker, they must be ordered to go back for remedial training. Because after 2 procedures, they could not trace the foreign body in that young girl. You can imagine the pain that she underwent during surgical. So one of the recommendations, which I didn't see after Kenya Medical Practitioners and Dentists Council did not notice, wanted to recommend the remedial. Because God forbid, how many patients has gone through the hands and negligence as this, Mr. Speaker. Even they were supposed to even suspend the license of these doctors and medical team that including nurses, Mr. Speaker. They should even have what we call penalties and fines, because under Section 20 of Medical Practitioners and Dentists Act, Cap 253, and as revised in 2019. And I know Senator Dr. Boni Khalwala understands this. There must have been proper, Mr. Speaker, penalty. We should have had a fine against this medical team. One is caution, another one is reprimand, another one is even I would have expected a probation. They should have done a probation, Mr. Speaker, for this medical team, including the team leader, Dr. Odingo and company. They should have been taken for probation even 6 months for remedial courses, and also being supervised by Kenya Medical and Dentist Practitioners Council, Mr. Speaker. So that we are certain, if today this report is public, if today a patient is supposed to go through under procedure of a team led by Dr. Odingo, do you still, Mr. Speaker, have the confidence that the procedure will be successful, Mr. Speaker? So the reading of Section Section 20 on medicals, medical and practitioners dentist act up 253 is very clear on disciplinary. I would have expected that this should have been done. Mr. Speaker, number 3, establish clear protocols of surgical procedure. I agree that they must be clear so that, Mr. Speaker, I'm told in the second operation, and whether Senator Kalwale will tell us this, in the second operation, there was no consent from the family or the guardian. They did second operation without the consent of the family. This is a clear violation and a clear criminal medical negligence, Mr. Speaker. How can you perform a procedure without the consent of the guardian or the family? The law is very clear. And that is why I'm saying Section 2020 of Medical Practitioners and Dentists Act, Cap 253, should have come heavy, with big, and ensure that there was at least proper punishment. But saying disciplinary procedures to be reviewed, investigate professional conduct, Mr. Speaker says that after the disciplinary action, the only recourse is after 30 days you can appeal to High Court, Mr. Speaker, as per the law. And therefore, I think that on the issue of medical procedures, surgical, it must be followed so that we ensure that critical medical procedures are all taken care of. I hope this medical negligence of Anita should be the last one. You saw Dr. Chacha of Kenyatta National Hospital. He was a doctor in Kenyatta National Hospital, but he could not be treated because he doesn't have money. Yet he is the doctor who was doing, who was working in Kapsabet, not Kapsabet, Kenyatta National Hospital referral, Mr. Speaker. When you look even at the patient advocacy, I disagree with this recommendation.